Hello friends, myself Dr. Maddineni Srinivas. So in this today's MCQ, we are going to look at the concept or rapid revision of rodent ulcer, that is basal cell carcinoma. So elderly lady coming with a growth which is now becoming ulcerated, we should always rule out basal cell carcinoma. So almost all students marked it right, very good. So few points about this, it is also called as rodent ulcer. Why? Because of its very peculiar nature of extreme invasiveness in the tissue which it involves, and the most common site which is affected is the line joining above the imaginary line between angle of mouth and the lobule of the ear. And you must also remember few of the facts that it is the most common primary malignancy of the skin. And what will be the treatment for this condition? It is MMS, but not the MMS which you are thinking. It is Mohs Micrographic surgery. And in the treatment, we can use Vismodegib and Sonidegib. One question for all of you: